Good evening, ladies. I hope you're all doing really well tonight. It is Wednesday. Welcome to Wellness Wednesday, especially for any new ladies who are uh, new to the group that maybe you haven't attended Wellness Wednesday before. I try to get on here every Wednesday and present a pertinent topic having to do with thyroid health, weight loss, so many related topics. So I'm going to go ahead and while everybody's jumping on, I need to say my disclaimer that I need to say every time I do a live event on the web. So I'll just get right into that. Anything that I say tonight is just health information and not specific health advice. Don't start taking or stop taking or change the way you're taking any of your medications. Uh, with that said, uh, it is your choice to talk to your prescribing practitioner if you feel like it is appropriate to make changes. And so I definitely recommend um, speaking with your practitioner if you feel like you need to change things. And attending this Wellness Wednesday does not establish a doctor-patient relationship. So again, welcome. And we've got a hot topic to discuss tonight. How safe really are all these new weight loss drugs meant first to be treatments for diabetes? So while several articles in my I have a journal article search or feed, while so the first many articles talk about all the potential, several positive health benefits of these drugs. Even though they're so new, they really don't have uh, the time to show any lasting data, any significant, truly significant positive health effects. But on the other hand, I just kept scrolling through and saw, you see several articles about all the side effects and negative health effects of these drugs, which you definitely will notice right away. Trulicity was among the first of these drugs. And so many of you may recognize that drug name. Although it wasn't prescribed for weight loss, it was simply prescribed for treating diabetes. Semaglutide, tirzepatide, and other similar formulations, liraglutide, I guess would be the other one, like Ozempic, Wegovy, Mounjaro, also known as Zepbound, and Saxenda. These are the major drugs that I'm going to be talking about tonight. They force the pancreas to release the right amount of insulin when blood sugar levels are high. So the consequences of releasing too much insulin when you don't need it uh, can be devastating to the body. Insulin is a highly toxic peptide hormone when it's not able to be used properly by the cells. And so your body's smart, especially if you don't have diabetes, it knows how to regulate glucose. And so your body releases just the right amount of insulin commensurate with what you need, depending on the amount of carbs you're intaking, and so forth, what you need. And so your cells, your organs, your muscles, brain, including your brain and even fat cells, respond by expressing or placing insulin receptors on the membranes of all your cells, the cells of those particular organs and tissues. So then insulin's supposed to be able to work to get glucose inside, and great, you use it, your organs use it, your muscles use it. But when too much insulin is secreted, well, at first, what happens is the insulin takes excess glucose, away out of the blood, and puts it, it may put it into those cells, but it also may put it into fat where it's designed to put it. Insulin is the fat storage hormone. And so, yeah, it's a great treatment for diabetes because great, considering all, I'm not actually saying it's great, but in the medical world, it's a great treatment for diabetes because it gets your blood sugar down. Okay, well, most of you who have a weight issue, and if you attended the last masterclass, and I will address this in the next masterclass as well, when you ladies who have a weight gain issue, at least 98% of the time, it is partly due to the fact that you already have some insulin resistance going on. So if you're following me, if you take these drugs, then you're going to produce more insulin. It's going to force your pancreas to produce more insulin. That makes you even more resistant to insulin. And then you have side effects. Okay. And there's a lot of them. The other, and we're going to get into that, and I will talk at length about those. All right. The other impact that these drugs have is in the gut. These drugs destroy they actually target what's called the enteric endocrine cells in the gut. And these enteric endocrine cells are vital for producing neurochemicals that help move the gut, that help the intestines move along, move their contents through to the end of the line and out. And one of those major neurochemicals is called GABA, gamma aminobutyric acid. Some of you may know that GABA is really important for the brain. It really helps us manage our moods. It helps us not be anxious. It helps calm us. It helps keep us even keeled, you might say. It helps you sleep. Okay. And so GABA is super important. Oh, it keeps your bowels moving. Okay. I was forgetting one last thing, and that was it. So GABA is a really important neurochemical that we need to be healthy. All right. And these drugs destroy that. I won't get into the real nitty gritty, but there is one insulin. So your body produces insulin in other ways, not just the pancreas. I know that sounds interesting or silly, but it's true that even insulin is produced by some of these enteric endocrine cells that are from the stomach down through the intestines. So there's a first phase of insulin secretion that happens to help get glucose into your cells right away. And then there's a secondary insulin secretion from the pancreas. And it's the first insulin secretion. It's like a small hill, and a big hill. Okay, so these drugs take out the small hill, so that's gone, and you go straight to the pancreas, the big hill, so you produce more insulin right away. Okay, and it's interesting because one of you asked a really important question, and I actually want to answer it now, because while we're talking about it, the question is, these drugs make you more diabetic? Okay, so not at first. Not at first. And it's because the insulin that they're causing you to produce more of ends up helping you put that sugar into fat. Okay. So you get a trade-off. When you're insulin resistant, and there are so many side effects with this that come about because of this, your muscles stop allowing insulin, glucose in. Your certain organs stop allowing glucose in because the insulin's not working there. They're more and more resistant to the action of insulin to unlock the door to let the glucose in. But it does put more glucose into fat. So there are so many are reporting negative side effects. And a recent article reported several severe mental health consequences relating to these drugs. Another recent article cites multiple cases of gastroparesis, which is where the intestines motion slows down, or it can become paralyzed. And so you stop moving food through. In fact, it can go the other way. And so you get you can get severe constipation. As a side effect, all right, one of the main one of the more dangerous side effects, or I should say the more disturbing side effects, is it causes cyclical vomiting syndrome. Okay, so this is ruining lives. This gastroparesis and cyclical vomiting syndrome, some people, especially women, can't even eat a little bit before it will come right back up. Okay, because of this, the disruption of the motion of the intestines to move food down through your, into your stomach, through the intestines, and so forth. All right, some typical side effects include notable muscle loss. This is because when you're not able to use glucose in the muscles and you use your muscles more because you don't stop living. I mean, you keep walking and taking care of kids and taking care of grandkids and working, and you continue to do this. And so by trying to use the muscle and not having enough glucose available, your muscles eat themselves for energy. And so you get atrophy, muscle atrophy, and that's muscle loss. This can ultimately cause heart damage as well, and nerve damage, because these organs and tissues also need glucose inside as fuel. So these are typical complications of diabetes, but what's going on is these drugs are hastening these effects, these complications, even when blood sugar is down. It's crazy. Severe depression and suicidal thoughts are becoming more and more mainstream with these drugs. A study reviewing the European Medicine Agency's system for managing and reporting side effects looked at the 31,444 reported adverse events and found 481 were adverse psychiatric episodes in total. So I'm quoting, I'm going to read what this said. According to the study's findings, women made up 65% of the reports, while men accounted for 29%. Tobacki said, fatal outcomes were predominantly among men, 8 out of 9, resulting from completed suicide attempts and depression. This is a serious matter and warrants attention. All right. These drugs also increase keto acid release from fat. Now, the complication is one in a long line of these side effects that I'm talking about, linked to these GLP-1 agonists. That's the type of drug we're talking about. They're GLP-1 agonists, so you can look these up, such as Ozempic and Mounjaro, right, which have been linked to more than 100 deaths in the United States. Hang tight, I'm going to share my screen just to show you a graph. So you should be looking at this graph. I'm going to make it bigger. And this just is tracking deaths, and this is the FDA is reporting these. So from 2018 to 2023, of course, we don't have this year's data yet. You can see what's happening, especially as the prescription quantity increases. We're getting more and more deaths linked to these weight loss drugs. Okay, this is a serious issue, and that's why I'm talking about it today. Okay, so normally the body breaks down glucose or sugar in food, and it converts it to energy. So we're talking about ketoacidosis. But when the body doesn't get enough, it breaks down fat, right? Fat stores as a backup. And this chemical reaction produces ketones as a byproduct. And many of you have heard of and are familiar with the ketogenic diet. When your body has to do this out of necessity, because of fasting, it breaks it down a little differently. And so that's why, another reason why fasting is not always the best strategy for weight loss, because these keto acids can lead to serious problems. So this could be more likely in patients taking these GLP-1 agonists, such as Ozempic or Mounjaro or Wegovy, because the drugs suppress appetite, meaning patients don't get as much fuel from food as they need. And so they go into starvation mode, right? Ketoacidosis is normally seen in diabetic patients because their bodies cannot produce enough insulin, or they can't use enough insulin, which helps convert food into energy, causing them to break down the fat instead. So that makes sense. Normally, this would be okay if you weren't also losing muscle and decreasing nerve function. Okay, so think about this. If you're losing muscle and you're in starvation mode, this will cause major issues. Other symptoms include thirst, frequent urination, vomiting, stomach pain, weakness, shortness of breath, confusion, fruity smelling breath. So this is because ketoacidosis produces high levels of this chemical acetone, which has this distinctive fruity odor. Okay. Left untreated, ketoacidosis can lead to low blood sugar, brain swelling, and ultimately death. And this is what some of these deaths have been. Now, I know some of these some of these stories that we hear are anecdotes, but would you want to be one of these patients? Many patients have told the dailymail.com they suffered from organ failure, stomach paralysis, and suicidal thoughts. One of them includes a mother who suffered kidney failure on her daughter's birthday, and a man whose sister begged him for the third time not to commit suicide after Ozempic ruined his life. Okay, this is a very real thing. There are, they don't work for some people. Okay, also, there's a wide variation in weight loss on these types of drugs called GLP-1. So doctors say roughly 10 to 15% of people who try them are non-responders, typically defined as, I want to say it was those who lose less than 5% of their body weight, excuse me. These patients, doctors say, don't experience enough appetite reduction to result in significant weight loss. Well, the true consequences of appetite reduction and caloric intake reduction, remember, if you attended the masterclass, you know that this is one of the weight loss fallacies. So reducing calories is really never a good idea for lasting weight loss, especially when your body goes into starvation mode, can create keto acids, or it just goes into, your cells go into basically hibernation mode, and no matter how much fat you have, your body thinks you need to store more because you're starving. Pretty simple. Now, doctors believe that some people might also be resistant to the drugs as a result of genetics, right? Genetic differences. Other possible reasons could include certain medical conditions and medications, how much weight a person has lost before taking the drugs, differences in how people metabolize them, and so forth. Several studies are showing these drugs may also lead to surgical complications like aspiration pneumonia. Once again, because it causes the opposite motion to happen or no motion. And so these, when you've got food that isn't emptying from your stomach into the intestines, it's going the other way after surgery or during surgery. Okay. In my humble opinion, these drugs are very dangerous. They do nothing to address the root causes for why you have a weight issue in the first place. They cause more stress on the body and harm to your organs and cells and tissues. And you have to be on them for the rest of your life, or you will gain the weight right back. So many of the articles that were in my research feed there address this very fact, that you really have to stay on them for life if you want to expect to keep the weight off. And if you're lucky enough to avoid any of these complications, then great. I just don't think they are the miracle that we've all been waiting for weight loss. Now, I'm going to get to some questions. So give me just a second, and I am going to see if there are any questions. In the chat. Okay. So the question is, I have a friend who says she is addicted to this drug. She is skeletal at this point, meaning she's lost so much muscle. Can she stop and heal, or is it too late? She can stop. It's not something that, I mean, she's going to gain weight back, but it's not going to be muscle. If anything, it's going to be fat, because without the muscle for insulin to help glucose into, this is a really sad situation. Now, if she really has some close supervision, I think that if otherwise healthy enough, she could possibly consume enough protein, be able to, with some help digesting it perhaps, um, and she may be able to gain some muscle back, but it would be a long road, and it's going to require a lot of supervision by a doctor who knows what to do. So again, very, very sad situation, but that's probably what would be how I'd have to answer that question. How frequently do you have patients that come in with a cyclical vomiting syndrome? It sounds awful. So I personally haven't had any patients come in with this. I've just read articles and have have seen these reports of so many patients. People that have side effects will report them. People that have positive outcomes are not necessarily going to report the positive outcomes online. So if you have a negative side effect or something, you're going to be more vocal about it, right? And so it's one of those that I hear about it. You read about it, and you just don't want to be that patient. You don't want that to happen to you. Another question is, okay, one second. It's kind of tough to scroll through these because there's a delay. So the question is, will slow move T help with fighting off these drugs, keeping us from having normal BMs? Or smooth move T is really what you're looking for. And I would say that I mean, yes and no, but that's when you're having that complication, you don't want it to continue. You don't want it to get worse. So I would just, yes, there is some advantage to taking that. Let me get to a couple more questions. And so do you work with patients who are on these drugs? Well, if you become my patient, if I work with you, then we're going to try to get you off of them as soon as possible. All right. Now, thankfully, many of you, if you have been taking them, probably haven't been taking them for long. And the shorter you've been taking them, the easier it is to really get to the point where you can just come off. And you don't have to necessarily wean off them. They just need to come off if that's what we're going to help you to do. Again, I'm not giving you any advice here. I'm just saying if that were the case and you became one of our patients, then we would work with you to fix the underlying causes, right? For the weight issue. Why are these drugs so popular if they're so dangerous? Because they get a lot of positive publicity, and their article after article also talk about all the potential possible effects, and they're amazing for weight loss, and this is what everybody's looking for. When that's the message being shared, and the other side of it is very much being ignored. And it's not, all doctors are not ignoring the negatives. I have been on doctor forums that I'm part of that some doctors on there are very hesitant to prescribe these drugs, and yet they're being pressured by insurance and patients to prescribe them for not just diabetes but for weight loss. What do you do? when the media and the loudest speakers are saying it's positive, right? All right. So I think I answered the questions. Cherry Ann can let me know if there are any stragglers, but I think it's really important, ladies, that we not try to find the quick fix. There's not a quick fix for losing weight. These drugs, the Trulicity, again, that is mainly for diabetes, but it's being used sometimes for weight loss now. These are all injectables. Oh, and they're okay. The injectables are Trulicity, Mounjaro, which is okay. I'm gonna get this. Liraglutide is yeah. Tirzepatide is Mounjaro. Semaglutide is Ozempic, Wegovy. Saxenda is liraglutide. That's what it is. Have to do some rearrangement in my brain for a minute there. And these are injectables. There was just an article I read that came across my feed the other day that's saying that a pill form of Mounjaro is on the way. Oh my gosh, that makes it even easier to have issues with these drugs. So, ladies, there is no quick fix. You've got to get the right testing to figure out what are your underlying causes, what your underlying imbalances are, what are the real reasons why you're having difficulty with weight loss, or if you do lose a little bit, why you can't keep it off, and why you don't lose more. And all I can say is it's so important to get comprehensive testing. And I will be doing another masterclass coming up this summer, and that's going to help you understand what you need to do to know what you need to know and what you need to do to really address these root causes. So I think that's it. I think that's all I have for you tonight. Thanks for your questions, because this is a big issue, and I really I can't keep quiet because, like one of you pointed out, they're so popular and they're touted as the miracle weight loss treatment. And I just disagree, because I see the side effects. I've seen the sad outcomes for a few people, and I just don't want it to happen to any of you. So there you have it. I'll sign off for now. Have a wonderful evening, and we'll see you soon. Remember, you have the power to heal. Take care.